Hello everyone, my name is Aishwarya Kulkarni and today I will be talking about my dissertation which is on the topic how effective is dance movement therapy or a dance intervention in treating depression in adult population. So why dance? So dance is an art form which has held a significantly special place in my life and in my heart. I have been training to become a classical dancer for last 20 to 21 years now. Also, I thought why not find out if this dance can be incorporated in any way within the psychological therapy, that is, a psychotherapy or counseling in order to treat depression. And that is how I landed on this topic. So, the aspects that I will be covering in this presentation are background research, my research question, methodology, results and findings, discussions, as well as limitations, along with the future research implications and a take-home message. So as we know, depression in any form is characterized by the following symptoms such as low mood, lack of interest in daily life tasks, low energy, poor appetite or loss of appetite, or overeating, low self-worth or confidence, as well as sleep disturbances. So, what does the past research have to say about this? The past research says that conventionally, CBT, REBT, and psychodynamic therapy as well as person-centered therapy have been effective in treating adult depression. However, recently there have been an increasing popularity for a new form of therapy which is multimodal therapy in order to treat depression. Now, why is it called as multimodal? Because it actually incorporates multiple modes, such as multiple senses, along with the bodily movements, as well as incorporating the significant aspects from multiple approaches, such as, for example, Gestalt approach, psychodynamic approach, or person-centered approach, etc. So, dance movement therapy can be considered as one form of multimodal therapy. Why? Because dance movement therapy incorporates various aspects through emotions, that is, expression of emotions, through facial expressions and bodily movements, called as embodied emotions, cognitive aspect, that is, coordination of body while it moves, as well as social and spiritual aspect. So, most of the times, dance movement therapy is actually conducted within the group. So, kinesthetic empathy, that is, empathy which is expressed through bodily movements as well as touch, has a major role to play in this intervention. So, speaking of my research question I kept it a bit open because since this is much of a niche topic, even I wasn't aware what I was going to find out, since there wasn't much literature available with respect to the same. So, my topic, basically, my research question that I considered here was how DMT is effective to treat depression in adults, for which the methodology which I adopted was a systematic literature review. Since it was not feasible to actually get a DMT therapist and conduct the session because of the difficult times created by pandemic, I instead focused on identifying the gaps in the existent literature in order to find out whether the future research can be conducted, how effective can DMT be in treating depression, and what are the possible areas for future research. So, in the strategy, the keywords that I used were dance therapy, movement therapy, dance intervention, DMT, depression, dysthymia. And the databases used were four databases, which I referred to, and they were MEDLINE, Science Direct, Psych Info, Taylor and Francis. In terms of selecting the study, two groups of characteristics were considered. One was overall or generic study characteristics, and secondly, intervention characteristics. Speaking of study characteristics, they were mostly in terms of the name of the author, year in which the study was published. So most of the studies considered here ranged from the year 2000 till now. Study designs, most of the studies used mixed method designs. Some of them used qualitative designs and some of them were even quasi-experimental. Participants who were adults Studies having the adult participants were considered, not the studies with an adolescent participant population. Similarly, type of psychotherapeutic intervention which was used in the studies, and lastly, primary outcome measures. Of course, secondary outcome measures were considered. However, since they were quite heterogeneous across all the studies, major emphasis was made on primary outcome measures. Speaking of intervention characteristics, they were considered in terms of number of DMT sessions or dance intervention sessions, whether dance intervention sessions were used with the talking therapy, number of dance intervention sessions or DMT sessions with pharmacological intervention, and lastly, approach, model, and application of the same in order to treat depression. So, what were the results and findings? In order to simplify the process of analysis, these studies were classified into four groups, namely dance viewed as exercise, dance or DMT used in psychiatric settings, DMT used with breast cancer patients, DMT used with the elderly population. And in terms of duration, you can clearly observe most of the studies used the intervention within the study for extensively period ranging from 0 weeks to 20 weeks, whereas only couple of studies used the interventions ranging from the period of 21 weeks to 40 weeks. That is 0 weeks till 40 weeks basically. So moving ahead, another interesting finding was that the gender distribution across all the studies was found to be quite interesting. The proportion of female population participating and completing the study dedicatedly till the follow-up stage was considerably high as compared to male population. Why? I have discussed it in the possibility. The possibility for same happening. I have discussed it in the coming discussion session. In terms of outcome sessions, there were different outcome measures. Different outcome measures were used, such as Beck Depression Inventory, that is BDI, which was the most common measure. Also, they were very specific to the population that was being considered in different studies. So, for example, if it was elderly population, geriatric depression scale was used. If it was population in psychiatric settings, depression and anxiety scale or hospital anxiety and depression scale was used. So it was very population specific, the outcome measures which were used, primary outcome measures I'm talking about here. In terms of effect sizes, as you can see, it's quite haphazard because as you can see, the moderate effect size was found commonly in most of the studies. High effect size was found primarily in psychiatric settings, as well as low effect size was found in breast cancer settings. The patients with breast cancer. Now, why is this so haphazard? The reason for the same is explained in this slide. Because out of 28 studies, only 13 studies mentioned effect size or measured effect size. The rest of the studies had no mention of effect size. That doesn't mean dance movement therapy was less effective. However, it definitely means that the effect size was not measured. How effective the intensity of that effect was not measured. One reason that the sample size was quite different and quite heterogeneous across all the studies. Also, the effect size was measured in terms of Cohen's d. So out of these 13 studies, 5 studies showed high effect size ranging approximately between 0.7 to 0.9. 5 studies showed moderate effect size ranging from 0.5 to 0.7, and 3 studies showed low effect size ranging from 0.1 to 0.4. So in order to test this bias and to understand this bias, Cochrane's risk of bias assessment tool was used, whether to see if there was selection bias, if there was a reporting bias, if there was any bias created because of the experience of the dance movement therapist, etc. So moving ahead, now we will move on towards the discussion part. So these are the points that I will be covering one by one in the discussion, starting with study characteristics. As explained earlier, some studies were quasi-experimental. So they incorporated quasi-experimental design, meaning that the predefined inclusion criteria existed and the population was not randomly assigned to the control group and intervention group. Also, the way in which the population selected was not random. It was more or less based on the predetermined criteria, and the population which did not fit in that criteria was straight away excluded from the study. Sometimes doing this entail contamination. I'm not saying the contamination happened for sure. However, there could be a possibility of some degree of contamination happening in the data since there was a predefined criteria over here. Overall, DMT and dance intervention was found to be effective. As I mentioned earlier, yes, it was effective for most of the studies. Most of the studies showed high significance level on t-test, ANOVA, different measures which were used to significantly identify the differences, mean differences between the control group and intervention group. However, they did not describe what aspects of DMT helped in doing the same. Also, there was lots of attrition bias which was found in the participants. So there was heterogeneity in terms of sample sizes which was observed. How? For example, out of 28 studies, the sample size for 9 studies actually fell between the range of 100 to 200 participants and 200 to 300 participants. As for remaining 19 studies, the sample size ranged between 0 to 100 participants, out of which for 15 studies out of those 19 studies, less than 50 participants actually completed the study till follow-up, which shows 50%, around 50% of studies had high dropout rate, which might be the possible cause of attrition bias happening in those studies. Moving ahead, in terms of specific dance movement therapy, only 7 studies actually employed dance movement therapy intervention, and out of which only one study mentioned that yes, they used Chasian, the dance movement therapy school, which was actually coined by Marian Chase. So only few of them mentioned that Chasian dance movement therapy was, only one study described that Chasian dance movement therapy was used, whereas other studies did not describe any specific school of dance movement therapy. Nevertheless, they did describe certain, they did show certain degree of commonality in terms of the premise, like here and now element, being in the moment, concrete involvement in the moment, and also creativity, which was used in the form of spontaneous improvisation, and the playfulness, which was encouraged within the participants. In terms of other dance interventions, basically, even if most of the studies, other studies apart from those 7 studies involved other dance interventions, as you can clearly see here, we can see range of dance interventions that are used here. They rested on the common grounds led by DMT, namely mindfulness, embodiment of emotions, social interaction within the group, kinesthetic empathy as described earlier, and familiarity and improvement. So familiarity element, the finding regarding the same was quite interesting because familiarity helped in inducing the element of nostalgia. For example, with the elderly population in one of the studies, which actually the population with which ballroom dancing was used. So this population could relate to that form of dance. So why? Because they were familiar to it. It incorporated the element of nostalgia, which actually increased their perceived effectiveness of the intervention. So familiarity with the dance intervention of that population had a major role to play in determining its effectiveness with the same. In terms of gender-based differences, as I mentioned earlier, female population was, its participation was quite high as compared to male population. One reason behind the same could be that dance is often perceived as, it have always been perceived as effeminate activity. And often males are not found to be comfortable with dance. I can't dance. It's the common phrase which is used amongst most of males. Of course, there are male dancers out there, but however, it is considered to be an effeminate activity. Secondly, female motivation towards dedicatedly completing the studies, that is one area which remains unexplored and which can be explored in the future research. Also, the male perception of dance is another area, and what can be done about it can be something that can be explored in further research. Instructors' experience as well as session duration. So the extent to which participants often felt this bias created by having two left feet. Oh, I can't dance. Sometimes there is this belief commonly seen amongst people, I can't dance, I find it difficult, I'm not a dancer. So this bias was considerably reduced when the experience of the DMT therapist was found to be significantly high, and their ability to engage the participant in the dance intervention actually helped in determining how effective was that intervention perceived by the participants. Also, the duration and time allotted and the perceived effectiveness, showed moderate correlation. Further, these findings should definitely be considered under the light of limitations. So there must have been a potential bias in the way studies were screened. I am from a classical dance background. My partner was from a music therapy background. So the way in which the studies were screened might have entailed some potential bias. Also, Cochrane's risk of bias assessment is a subjective tool. It's an effective tool, however, it is subjective. So the way in which bias was identified and interpreted might have entailed potential bias. Small sample size in various studies, hence leading to inflated effect sizes. Not all the studies mentioned effect sizes. Also, potential flexibility in the way in which intervention was applied, and certain existent methodological issues. So lastly, what are the future implications? So I'll quickly sum up whatever we discussed in the discussions. How effective are particular schools of DMT in treating depression could be one interesting area to explore. Motivation of female population behind completing the study, and effectiveness of DMT in collaboration with the talking therapy. So these could be few possible areas to explore in the future research. Also, overall, DMT was found to be an effective form of multimodal intervention. Expertise of instructor, yes, had an important role to play there in the perceived effectiveness. Now, you might think that because I am from a dance background, I am very close to this form of intervention. No. To be a DMT therapist, there is no need to be a trained dancer. However, a training in dance movement therapy is required because it involves incorporation of counseling aspects as well as dance aspects together. So you need not be a dancer, but definitely in order to identify the therapeuticness of moments and of embodiment of emotions, a proper training is required in this field. So that is my take home message from this presentation. So I hope you enjoyed my presentation. Have a nice evening. Bye bye.